has been destroyed, which is the site of, primary site of red blood cell production, right? So if the red bone marrow is destroyed, then what will happen? Production will be less. Make sense? So the person's blood will have lower count of red blood cells. Make sense? Now that's called aplastic anemia due to destruction or malfunction or depression of bone marrow, red bone marrow, the primary site of the blood cell production. If that happens, that kind of anemia is called aplastic anemia, where the count of red blood cell is low because production site is destroyed. Now, what can cause depression of bone marrow or destruction of bone marrow? Some treatment like chemotherapy, some medicines, okay? Strong medicines can depress the bone marrow. Excessive radiation, bone cancer can destroy the bone marrow, right? Or, you know, what else I said, like excessive radiation, some medicines, okay, that can depress the bone marrow. So now, that's why some people don't like to go through when they pass, you know, they fly, frequent flyers, they don't like to be, you know, scanned every time. Excessive, you know, X-ray or radiation can depress your bone marrow, okay, and that can lead to aplastic anemia, okay. Okay, so you see here, loss of blood, right, either chronic or acute, or if the production is less, that will also decrease the number, right? So, two things. That's the number of red blood cell. Now we'll talk about the amount of hemoglobin. What can change the amount of hemoglobin inside the red blood cell? There are few important chemicals are needed for the synthesis of hemoglobin. One is vitamin B12, another is folic acid, another is called intrinsic factor, intrinsic factors, and the last one or first one, whatever you say, iron, Fe, iron. So how many I said? Iron, 4, right? Folic acids, intrinsic factors, and vitamin B12. Just know that, right? Those 4 are very important for the synthesis of what? Of hemoglobin. So lack of any one or more will do what? Will decrease the synthesis of what? Hemoglobin. So this is not related to the red blood cell production or loss, right? So this is related to hemoglobin amount. So that is called low hemoglobin content anemia. Makes sense, right? In general, low hemoglobin content anemia. And due to loss of blood or lack of production of blood, that will say decreased red blood cell induced anemia. Makes sense? That's the two reasons. It's decrease the number of red blood cell and decrease the amount of hemoglobin, low hemoglobin content anemia. Also called hypochromatic color, by looking the color. Hypo, less color, that means less hemoglobin. Makes sense? Hypochromatic. Okay. So this is low hemoglobin content. Now see another thing. The third thing of anemia is this blood has same amount of hemoglobin like normal, but the hemoglobin in this one is abnormal hemoglobin.
The sickle cell?
Yes. So this hemoglobin is normal or abnormal?
Normal.
Abnormal. This is normal, right? So you see the amount is same, but this hemoglobin is non-functional, abnormal. They cannot bind with oxygen. Is it clear? So that is abnormal hemoglobin. That will also decrease the oxygen carrying capacity and will cause anemia. Is it clear? So now, three things you got. One is decreased the number, right, of red blood cell. Number one type of anemia. Number two, decrease the amount of what? Hemoglobin inside the red blood cell. Is it clear? Low hemoglobin content. That hemoglobin is normal, but amount is less. Is it clear? And number three is hemoglobin amount is good, but not functioning. Abnormal hemoglobin. A good example is sickle cell anemia. You see here, the hemoglobin becomes like sickle. Have you heard the term sickle? What is that?
Farming implements.
Yes. The farmers, now they don't use much, right? They used to cut the, the paddy crops using the knife, like carved knife, like this, okay? So sickle. So the shape of hemoglobin becomes like that, S kind of carved, okay? Normally it should be nice round, but it's carved. Not only that, this hemoglobin becomes hard like crystal, and cannot carry oxygen, cannot bind with oxygen, okay? So you see, when the hemoglobin becomes hard like crystal and becomes sickle shape, many of these red blood cell membranes are destroyed because the hemoglobin is hard and the ends are pointed. So the cell membrane will be destroyed easily. Is it clear? Because it is not soft. Okay? So red blood cell destruction will occur, and sometimes what happens, the small arteries or capillaries are blocked by this hemoglobin. So this area will not get enough oxygen because these are not carrying oxygen. That is the first thing. Second is the blockage. So the body tissue will not get enough oxygen, and that's why the sickle cell patient, they suffer from severe pain in the body. Makes sense, right? If lack of oxygen, you know that causes ischemia, pain, right? They suffer from severe pain. There is no treatment of sickle cell anemia. That happens mostly in African black people. Okay, about 20% of African Americans, they carry that gene. It is a hereditary disorder, genetic disorder. Okay, this faulty gene causes that. So, that's the sickle cell anemia, and the treatment is symptomatic. That means we can relieve the pain, right? By painkiller, or if the symptom is pain, you will use painkiller to reduce. Blood transfusion helps a little bit, but how long you will do that, right? Because your bone marrow is continuously producing sickle cell, not normal cell. Okay, so you can do blood transfusion, give healthy blood, but again the bone marrow will produce sickle cells. Okay. So that is abnormal hemoglobin content anemia. Okay, so low hemoglobin content anemia, abnormal hemoglobin content anemia. Let's stop here. We'll continue the blood in next class.